During my career in community health sciences, I often got asked if I was a nurse or a doctor when I introduced myself. And no, I was neither, and you don't have to be. We have a very multidisciplinary department, and that's because health is about all kinds of things. So part of my career was studying the social determinants of health. One of my big focus was gender, another was culture. So I did a lot of research over my career with immigrants, and towards the end of my career, I was working with Aboriginal people, and I still am. So some of the interesting things that I studied was homelessness among Aboriginal people in Calgary, because we found out that the majority of the homeless population were Aboriginal people, and yet the services were not being provided for them. And what were their special needs, if any? And you can see that that's a real public health issue. Homelessness is not only a health issue for the people that are homeless, but it represents something about our society. It identifies a problem in our population, and that affects the population's well-being. It affects all of us to walk around and see people who don't have a place to sleep. I've also done a lot of research over my career trying to prevent violence against women and children. And although that sounds sad, it hasn't been, because my career is in health promotion, so I'm looking for solutions. And one of the happiest days of my career was in 2015 when, working with a colleague who grew up in Calgary but now is at the University of Windsor, we developed a program for first-year university women that prevents rape. And we found out through a randomized controlled trial, which isn't that common in health promotion, but is just an example of the kind of exciting research methods that you can use in population health. We found out that it's very successful. So that's been a very happy crowning of a career in population and public health. And I'm continuing on with my colleagues on that project to scale it up. And now we have to figure out how to make it effective on a large-scale basis, because a randomized controlled trial, you'll learn if you come and study population health, is a very controlled environment. It's not the same as society or everyday life. So there are lots of things that people who have a background in social work or psychology or law can do in community health sciences. So if you're a faculty member already, or if you're graduating with a PhD, or if you're in a postdoc somewhere in Canada or, well, anywhere actually in the world, and you have common interests with the kind of things that I've talked about, you should consider coming to Calgary. It's a wonderful place to live, but this is an exciting and a growing university with exciting leadership at the present time. And I think you'll find lots of opportunities to do exciting projects and to make a change, which is what my career has been all about, is trying to make a change in society for people who suffer more than is necessary.